Namaskara, Ahara Arogya Adhyatma, the light of Samskara. Welcome to the program. Today we have Dr. Uday Patil, a renowned, very popular ophthalmologist of Kalburgi. And he is in charge of the mobile eye clinic for many years, more than 16 years, and he has treated thousands of patients. More than that, he has a compassion and kindness for the suffering of the humanity, and he is a writer, a prolific writer, and he always whatever he feels he puts it in writing. And for writing, reading is important. For reading, the eyes are important. So many a times, when in the life we get injured, and when we are going to have accident, when we are going to have any injury, we don't know. But when we injure other parts of the body, somehow they can be treated. The injury, the wound heals. But when the injury occurs to the eye, we may lose the sight, and nothing can be done. And so today he is going to tell us about the emergencies in eye and how to prevent them, and what are the causes for the emergencies, and how to manage, and more than that, in order to prevent, what to do. So welcome, Dr. Uday Patil ji. Namaskar.
Good morning,
So
madam. Good morning.
please tell us, what are these eye injuries and that makes it emergency, and how to prevent them, and if they come with that, what the patient has to take care, and how they have to reach the hospital, I mean the ophthalmologist in time, and what treatments are available. Please tell us, sir. Please go ahead.
Good morning, madam. Compared to other batches of medicine like OBG, medicine, surgery, orthopedic,
Cardiology.
cardiology, ophthalmology has got few emergencies, but they are very vital emergencies. So, so usually they say ophthalmologist life is very silent. Though no emergency, they
Sedentary.
silent.
Very comfortable.
Very rarely we get up in the night and attend the calls, but they are now common. And few emergencies I have seen in my ophthalmic practicing career. Let me elaborate one by one. So most common for eyesight is your cornea. That is transparency cornea. Cornea is clear.
The outer layer of the eye.
Outer layer is a transparent small disc. If it is clear, then only we can see the world. Something goes wrong, some injury, then the cornea becomes opaque. Opaque means patient become blind. So commonest what I am seeing is the injuries, chemical injuries. Commonest chemical injuries we see the labor who are in the buildings, they paint the walls and ceiling, painting, and the lime particle.
Lime, yeah.
So the lime particle is very, very strong. When it enters accidentally falls in the eye, and the patient doesn't take care, the cornea totally melts away in 2 hours. Once the cornea gets melted, yes, it's very strong, no? So such injury, we should advise them, be careful, use glasses, as you said. And many they are poor class patients, they are not aware of the glasses also, protective glasses. So we should tell if any lime particle falls in your eye, immediately clean the eye with a clean water, potable water, and go to a ophthalmologist. He will treat you in time. If you delay going to ophthalmologist, by the time, today morning I have fallen, tomorrow evening I will go. If they delay going to ophthalmologist, then the cornea gets melted away and we cannot do anything. And many people I have seen in cleaning their bathrooms or toilet, they use some carbonic acid phenyl. Accidentally, it may fall in the eye, and they do not wash their eye properly and do not go to ophthalmologist, and it will cause a lot of problems. And if it's bad luck, the particle gets stuck in the cornea, then the corneal infection.
Especially some people use the acid for cleaning the tiles and other things. And that acid, if it splashes, then it's a problem.
Acid injuries. And I've seen many people, women using hair dyes for to blacken their hair.
Not women, sir. Men are also using. It's not the women, it's the men also. Yeah.
The darkness of the hair dye is because of ammonium chloride, and it is toxic dye. If they do not take proper care, when they wash their head, if they do not take, the dye may enter the eye and it may cause small irritation. This is very common. Sometimes they do not take care, and the dye enters the eye. I seen one patient developing cancer in the eye because of the
Okay.
hair dye. So they
Okay.
use the format period. These are the
Okay.
education we have to
So
educate
that
them.
means while dyeing the hair also it may go, or while washing also it may go into the eye if they have
Yes,
not
mainly
closed.
by washing.
And
Yes.
so it will cause irritation and redness, and then if it repeatedly occurs, then the
Yes.
cancer occurs. Okay.
I seen. So these are the few emergencies, and many patients they develop cataract in the old age. They are not
Okay.
aware of their surgery, and they delay. Sometimes the less swollen lens just breaks, and it will
Okay.
cause lens-induced glaucoma.
Yeah,
So it is one of
it is it becomes solidified and thing, and that it will injure. Okay.
may occlude the angle of entry chamber and the pressure
Okay.
increases. So if the treatment is delayed, they lose permanent eyesight. This is one of the awareness of the corneal injuries.
So
And
but just cataract, if they come and get operated and get a lens implanted, they will be eye will be fine. But if they delay and it becomes over mature and then it bursts, then the problem. Okay,
so
sir.
these are the few emergencies and the sports injuries,
Yes.
tennis ball injuries, these people with the cricket ball or chidi
Cricket
dandu.
ball.
These are very common injuries, and the
Yes.
school going children, the sharp pencil may
Yes.
injury. I've seen some
Yeah.
people playing with the pencil, the sharpness
Okay.
going to the cornea. Most
Yeah.
important is corneal injuries, and if the injury is more, then the steroid will get steroid tear will occur. So
Yeah,
they,
this cricket ball injury was very common when we were children. Even the captain of cricket match, Patodi, also had the injury. But now they have the mask. But our
helmet.
children who are playing, for the heck of it, they will not have protection, and that's the reason they have to be very careful. Yes.
Very good, very good. There's very so few injuries in ophthalmic, but you have to treat them with timely treatment and make create awareness.
Yeah,
So
and
every
one more thing, sir. Only during the Diwali or Deepavali season, lots of children come to Minto and other places, and that also is very important. No, sir, one has to be very careful.
now Deepavali is covering cracker injuries. Even if you play the cracker in shape, nowadays what they are doing, we see in the shops, they do Lakshmi Puja and crackers, and the crack, ladi, lambi ladi rehti hai. So cracker injury may hit the eye, and especially in welding people, welding particles, the
Well done.
hot
Okay.
iron particle, it may pierce the cornea, enter the eye sac, and the cornea, the iron particle get disintegrated, may cause iron complication called sclerosis bulbi. These are one of this happens, they gradually lose eyesight. With foreign bodies, welding people, we educate them to use the dark glasses. And if the foreign body is conjunctival foreign body, there is no harm. But if the foreign body sticks to cornea, then it is an emergency. He has to come to an ophthalmologist. Otherwise,
Sir, in the olden days, the amoebiasis also used to think, no, that there's a parasite. Some of the parasites also can get accumulated in the eyes. Yeah.
I think some lower worms. But it's not emergency. They keep on coming. There is a lot of irritation. When you examine, you can see a small worm in the conjunctiva.
Okay.
That is irritation.
Moving. Okay. Okay.
That is one of the. We see some very parasitic infections also. Amoebiasis and hook infection. Many parasites they may enter the eye. So now it has become a little less, madam.
Much less.
Less
Okay.
because of more awareness, and people are using now lot
And
of
hygiene. The people
hygiene,
know about the health and hygiene.
hygiene
Okay.
now. Because that's why and even contact lenses they are using. And nowadays contact lenses will come down, but on occasions for marriages, engagement party, the girls they do not take proper care. The contact lens itself may cause the corneal injury.
Injury. Okay. Okay.
Injuries, and there is some injury to the iris body, ciliary body. They neglect, then the allergic infection may spread to other eyes called as sympathetic ophthalmitis. There are few rare complications, but they are recorded. Few emergencies in ophthalmology where you should create awareness among the public whenever they come to our clinic for refraction. You should tell them, especially, but I always tell the people who come to my clinic, especially hypertension patients and diabetic, when I see there is one condition called central retinal artery occlusion. very
Okay.
common among the diabetics and hypertension. Small,
Hmm.
like you see coronary artery blockage, the small block may happen, occur in the central retinal artery. The artery is very small. When the
Very
block is
small, very
there,
small.
very
Yeah.
small, very smallest block may cause the completely the retina will not
Loss
get
of
the blood
vision.
supply, and within second, within minute, the patient lose eyesight. The
Totally
painless,
blackout. Blackout.
painless cause of sudden loss of vision. You have to create awareness among the people who come to OPD, especially
So
hypertension patients.
how do you prevent when the sudden blackout occurs without pain? What do you do?
I
Just
advise
rubbing the
to
eyes are enough? Yeah.
gently rub on the eye for 30 seconds. If you
Okay.
rub, the thrombus may get dislodged, and suddenly you
Okay.
will be able to
It may
see.
go to the periphery. Okay. Huh.
Periphery. Very small artery through. This is very rarest, one of the rare ocular emergencies, but it is
Oh.
common among hypertensives and diabetics and some vascular diseases people, especially elderly people. It may occur in
Okay.
younger also, younger age group also. These are the few emergencies we should tell the patient, and other compared to other branches, our emergencies are come lesser, but we have to create awareness. Few ocular emergency we do see in our clinical practice, madam.
Hmm. And the carpenters also can come with the foreign body, when they are.
Carpenter, the chip may enter the eye, it may
Okay.
injure any called occupational hazards. Carpenters, goldsmiths, these labor people working in the building, construction building, all of they are very common. They get eye injuries.
Especially the welders, welding.
Welding people, the corneal foreign body is very common.
Mhm.
There are few emergencies,
So
madam.
but that means, to protect their eyes, they must wear the glasses so that,
Yes, yes,
all these injuries can be reduced. So
yes,
for just when we go in the sunlight, we wear the cooling glass. But when we are working, we don't take care. I think this awareness should be brought among the people.
awareness.
Yes,
Last
yes.
week we did awareness fortnight in Gulbarga. Every year we do the August month. It's called corneal eye donation week. We conduct. In this program, we educate the people who go to schools, colleges, public awareness. Not only corneal grafting, we tell the other also complications, and we create awareness among the public. So one of the
Okay.
last week I was there and doing this
Okay.
awareness
Okay.
program. For once in a year we do as a
Okay,
public.
okay. I think more than once a year, people should learn from you and do it at least twice in a year. And every school, it should be taught. So thank you very much for explaining about the occupational hazard as well as how the eye injuries can be emergencies and how they can be prevented or treated. Thank you very much, sir.
Thank you.